Good evening, everyone, and welcome to our Barrie Community Town Hall. I'm Suzanne Legui, Vice President, Strategy and Communications at Royal Victoria Regional Health Centre. Thank you for joining us this evening. Fingers crossed we have no technical issues as we adapt to our new virtual environment. There's no question these are anxious times. Over the past year, COVID-19 has changed almost everything in our homes, our schools, our businesses, and of course in healthcare. It seems every week brings new information, a different challenge, and I know we all have lots of questions about testing and the vaccine. We worry about safety, our families' mental health, our businesses, and how do we navigate this stay-at-home order? Tonight's panelists have all worked tirelessly together to ensure our community stays safe, and tonight we'll get invaluable information from Dr. Charles Gardner, Medical Officer of Health for the Simcoe Muskoka District Health Unit, Jana Scott, President and CEO of Royal Victoria Regional Health Centre, the Mayor of Barrie, Jeff Lehman, Chief Kimberly Greenwood from the Barrie Police Service, and Dr. Valerie Gerdisa, Chief Executive Officer of the Canadian Mental Health Association in Simcoe County. So, Dr. Gardner, let's begin with you. As Chief Medical Officer of Health for the region, you have been at the forefront of this pandemic, keeping us all informed and educated. What is the current COVID situation in Simcoe Muskoka, and what's the trend that you're seeing?
Well, bad timing. I assure everybody that I am perfectly well, but I would like to say hello to everybody, all the viewers, and I would like to say that, in fact, it's been the end of a difficult time for us. We have come through 5 months of increasing cases, and really the second wave has been much, much harder on us than the first wave. We have some 5,000 cases that have occurred to date. We've had 101 deaths so far. We have perhaps 10 times as many cases that have occurred in the first wave as the second wave. Our incidence is lower than the provincial incidence, but still very high. I would say that the southern portion of our territory is particularly hard hit, and certainly Barrie would be very much in keeping with that. We've had many institutional outbreaks. So we've had a total of 12 institutional outbreaks more recently. This would include 3 of our hospitals that have had outbreaks, 2 of them right now, a lot of long-term care facilities with outbreaks, and retirement homes. We've had a correctional facility in an outbreak. So clearly it's had a major impact on the well-being of people in Simcoe Muskoka. It's something that perhaps has come down a bit over the last week, which is a good thing. It's the first time we've seen some reduction in the climb, but it's been a total of 5 months. Really, last summer is when we've seen this rise, and that's one of the things I was reflecting on. Is that's actually quite a bit longer than the first wave in the spring. So, in my mind, there's plenty of reason for people to feel fatigued by this. And many people have been touched by this in their lives as well. Many people have known people who have become very seriously ill or have lost a loved one. It becomes really quite tragic. And certainly we've seen that tragedy in the outbreaks that have happened in our long-term care facilities. So Roberta Place would be, I think, the most serious of all that we've seen. And I know that we'll be reflecting on that a little bit later, but I would like to extend my condolences to the many, many people who've lost loved ones through all of this or have come through a very serious illness in all of this. It's been really the pandemic of the century and very, very hard on us all.
Certainly, the public's health, by definition, is what you do. And as the region's top doc, how concerned are you by what you're seeing in our region?
Very concerned, very concerned. The rates are very high, come down slightly over the last week, but they're very, very high. And when they're this high, it's particularly a vulnerable situation for those who are more likely to have a serious outcome. So our institutions, our long-term care facilities are very vulnerable. And the only silver lining, I would say, at this point is that we've now got a vaccine that we've been working with since the 22nd of December. And so we've been able to extend some protection to our long-term care facilities by providing vaccination to the people in those facilities. But other than that, there are many, many people that remain in the community. They're very vulnerable people who are older, people with pre-existing medical conditions who, because it's so common, really have to be careful. We all are called upon now to think twice about going out. There's in fact a stay-at-home order, and it's there for good reason. We now need to consider if we're going out that it be an essential purpose, and that otherwise it's safer to be at home. And certainly you need to be staying with your household members for close contact and maintaining physical distance from others. So, you know, it's a very serious situation, and I think it's very important that people take that to heart personally and take upon themselves responsibility for protecting their health and the health of their loved ones.
You mentioned Roberta Place, and we have watched that tragedy unfold. It's terrible to see. The outbreak has just really ravaged that long-term care home. And can you tell us more about that just terrible situation?
Well, it's very frightening because of how quickly it passed and just how many people in that facility have become cases. So almost all of the residents have become cases in the span of 2 weeks, which is terrible and extraordinary. It unfolded explosively within the first weekend. We declared the outbreak on the 8th of January, and then there were over 50 cases identified within a 3-day period after that. So it affected the whole facility, which made us very suspicious that in fact we were dealing with something extraordinary, not just your garden variety of COVID. We were aware of the UK strain as a possibility, and so we did ask Public Health Ontario to conduct the necessary tests to determine whether or not that's what we were dealing with. And we've got a preliminary result back suggesting that may very well be the case, awaiting the final result coming up in the weekend. But as I said, almost all of the residents, 122 of them, are cases. And because you know, this is such a severe virus for those that are older, particularly those in their 70s or 80s. We've had a high mortality rate already. So we now have 25 deaths in that facility, 6 in the last 24 hours. And I'm aware that there are others who are seriously ill there as well. So very disheartening. I also am very concerned about the well-being of the staff that are there. We've had some 70 of the staff now that have become cases, so perhaps half of the staff complement if you take into account the full-time staff, but also temporary staff have become cases. So a very, very disturbing and concerning situation.
It's tragic indeed.
Mm-hmm.
We have been under lockdown since Boxing Day, some kind of restrictions since last March. Why are the cases still soaring?
Well, this is truly an extraordinary virus. It is very communicable. If you think about it, our control measures have been highly effective in preventing influenza this season and preventing other viruses, respiratory viruses. They're basically at extremely low levels. So what we've been doing to try and stop COVID-19 has been highly effective in stopping these other respiratory viruses, and yet we continue to climb with cases. But it really speaks to just how difficult it is to control this virus. And the kind of lockdown measures that we now have in place, in fact, are necessary to control it. If you do half measures or you try to take a middle path with this virus, it's unforgiving and it continues to climb. And I think we're going to need this degree of strict lockdown, this stay-at-home order for some time to come in order to bring it down substantially. It's only starting to come down now provincially and locally. It's going to be a fairly long ride yet before we can get it to an acceptable level.
And yesterday we learned Simcoe Muskoka is not on the list of areas that will resume in-class learning next week. Good idea to keep our kids home right now?
That's always a tough call. Many of us in public health are really calling for a return to school where possible, because school is so important to children. It's important to their mental health and well-being. It's also very supportive of families, enabling those who can return to work, those who have essential work, to be able to return to work more easily. And so we've also noted that children do not as readily become cases, don't as readily transmit it. The kind of control measures we have had in school have mostly prevented transmission. We've had many more cases in children that have occurred through transmission in the community or in their family setting. And when they've gone to school, they've not transmitted much. And most of the time, there's no transmission. And perhaps one time out of 10, you get some transmission. And when it does happen, it's usually a very limited number of cases. So it certainly can be very disruptive to the school environment to deal with those exposures and to require the children in the class to be in isolation for the 14-day period that they'd be required, and that disrupts the ability of the schools to operate. And I can see why there would be rationale for closing them based on that, and there might very well be rationale based on people's concern. But on the whole, we're supportive of getting them back to school as much as possible.
Hopefully that will happen soon. You mentioned the light at the end of the tunnel. Let's move on to vaccines, and the region's immunization clinic in Barrie opened just before Christmas, as you mentioned. How's it going? Really what most people want to know tonight, I think, is when and how will the vaccine be accessible to the general public?
So we've done extraordinarily well here with our COVID vaccination, and this has been the product of our partnership together, RVH and SMDHO, the Simcoe Muskoka District Health Unit, and with a lot of support from the City of Barrie. The site that we use, the old police station, is property of the city, and the city provided hands-on labor to prepare the site. RVH as the recipient of the vaccine and the one for whom accountability is held with the province, and as the required deep freeze, and has provided all kinds of leadership and logistics and support, and then more and more personnel to actually vaccinate. At the very beginning, when we started on the 22nd of December, the vaccinators are all health unit employees. And we have shifted more recently when we've been allowed to move the Pfizer vaccine. So since the 6th of January, we've been able to take it off site and take it to long-term care facilities and provide it to the residents of those facilities and to staff in some instances as well. And that's been a tremendous blessing. Since Saturday, we've immunized all of the residents in all the long-term care facilities, and we're set to move on and cover the residents in the retirement homes. So to date, we've immunized some 14,000 people, and unfortunately, we can't carry on at the same pace because there's been this slowdown in the provision of vaccine. Pfizer has had to reduce its shipment of vaccine to Canada because they're reconfiguring their manufacturing process to be able to greatly increase their capacity. And so from now until probably late February, we're going to have much less vaccine to work with, and we're not able to proceed as in the same way that we were before. We have to concentrate on getting people their second dose. This is a vaccine that requires 2 doses, but we're committed to getting people that second dose as much as possible. We've had to extend out the time to the second dose. That's something that we're now allowed to do by the province to help us deal with this slowdown, but I'm committed to getting it to those who need it first. And right now, following provincial direction on who should get it. So I found there's just a tremendous interest in getting this vaccine, and all of us involved have received a lot of communication from people who want to get this vaccine, and that's a very good thing. But I would ask people to be patient because this is going to take us till August or September to complete the job. We have just 500,000 people in this district that will require 2 doses. That's going to take a long time.
So reason for hope and optimism, but everyone sure wishes we could speed things up. But thank you very much, Dr. Gardner. The immunization clinic, it really has been a terrific partnership with the City of Barrie, Health Unit, RVH. And Janice, let's just stay with the vaccine for a minute. So much work has gone into developing the region's immunization strategy. What has been the overriding philosophy since the clinic opened?
Thanks very much, Suzanne. Good evening, everyone. As Dr. Gardner mentioned, it's been a fantastic partnership to date. Our mission, our focus is to get as many vaccines in arms as quickly and safely as possible while not wasting any of the vaccine. And just to mention, of course, that our primary focus remains long-term care and high-risk retirement homes. They are the most vulnerable and most at risk, so we can receive the vaccine and we will save lives. I do also want to mention, though, the importance of immunizing as many workers as possible, whether they be in long-term care, retirement homes, or hospitals. We want to ensure that we protect the services that they provide so that we are there when you need us most. As Dr. Gardner said, it was very discouraging news that the Pfizer production had slowed down and therefore the supply of vaccine was going to be significantly less. We are able to pivot almost every day as we try to develop a plan that best meets the needs of the most vulnerable within the supply that we have available. As was mentioned by Dr. Gardner, the vaccine is coming in greater quantity by March, so the important takeaway message is that there is hope on the horizon.
The situation does change every day. It absolutely does. Today, RVH is caring for 37 COVID patients, close to 250,000 patients infected with the virus across the province now. And recent modeling suggests by February, we could see Ontario's intensive care units full. Sobering projections. What is the current situation at RVH, Janice, and how is our regional centre coping?
Well, as you said, currently today we have 37 COVID positive patients. That brings the total of COVID positive patients at RVH to 174 since the pandemic began. But to date, unlike the Toronto area, we have been relatively fortunate to not see the soaring numbers of COVID patients in our region, but those numbers are steadily increasing. So in an effort to load share and ensure those overburdened GTA hospitals can continue to provide safe care, we have accepted 84 transferred patients from 21 hospitals in the area. Now, unfortunately, we know that that number will continue to grow. We expect to receive 30 additional patients from the GTA this week alone. Some could be transferred to other hospitals in Simcoe, Muskoka, and RVH is playing a leadership role in coordinating those transfers. We all are in this together, and we're pleased to support our partners. In fact, RVH's mobile response team has supported 21 long-term care and retirement homes in our community with infection control, testing, housekeeping, and other support. It's important that we continue to look beyond our four walls and see how we can share the system's burden. In order to preserve bed capacity, we recently had to reduce our surgical activity and postpone some procedures, unfortunately. It isn't a complete ramp down, as hospitals were forced to do last winter. Currently, we're operating at about 75 to 80% of our normal activity, and it's important to note for everyone that emergency surgeries are not impacted. So at this time, we have not postponed outpatient clinics, and we're working very hard to maintain services despite the enormity of the second wave.
We are seeing hospitalization increase as well as critical care needs increasing. The hospital has increased bed capacity too, hasn't it?
Yes, recently we opened a new 26-bed unit in our former Centre for Education and Research, as well as another 29 beds throughout the health centre. And we continue to experience an increase in demand for intensive care beds. So today our 16-bed ICU is full, and we have now enacted our critical care surge plan, which increases our critical care capacity to 37 beds. Now, since the beginning of the pandemic, RVH has always planned for the worst. A major component of that plan has been the Regional Pandemic Response Unit. The PRU, as we call it, is a collaborative with all the hospitals in Simcoe, Muskoka. Initially was built as an insurance policy in the event of a significant capacity challenge in our region. It's operational now, and you can't miss it if you drive by RVH. It's an 8,000 square foot white field hospital in our parking lot, and it's connected to our health center by an enclosed walkway. Inside this modular structure are 70 patient bays outfitted with the equipment and technology a medically stable patient would need, like oxygen and a call bell system. There's even a separate attached structure with washrooms and a shower room. Now, important given our Barrie winters, this is a 4-season structure and it's able to withstand high winds and snow loads. We may not have tested the snow loads yet, but we certainly did have high winds earlier before Christmas. It's important to note, though, that the PRU is not a COVID unit, but it does provide added capacity for us to care for other medically stable patients.
Great foresight, for sure. So much has changed in the past year. What is RVH doing to protect patients and healthcare workers alike?
So many things have changed. We've introduced many strict infection prevention measures. For example, all staff and physicians in the hospital must wear a mask at all times and full personal protective equipment, PPE, whenever providing patient care. Screeners remain at the doors. There certainly is enhanced cleaning of the facility. We also opened a testing and an assessment center, and we've tested over 35,000 people since we began. Sadly, though, we've also had to suspend our volunteers, and I just wanted to say hello to all of them if they're listening. We know that we really, really miss our Blue Brigade. We've changed our spaces to ensure safety, including dividers at registration desks and new wait spaces for safe distancing. All surgical patients are COVID tested before their procedures. And as we see cases climb and with the introduction of provincial lockdown, once again, unfortunately, we had to introduce a no visitor policy, except for compassionate grounds, children, or laboring moms. And most recently, we've gone a little further. We had to restrict movement of patients throughout the health center. For instance, patients are prohibited from going down to the food court, and any visitors we do not have can't have them going in and out of the facility at any one time. If they come in to visit, they have to stay for the duration of their visit. I want to acknowledge that these restrictions are tough, but safety is our highest priority, and we must do everything we can to contain the spread.
As we say at RVH, safety is our promise, and until very recently, RVH has been fortunate to avoid a COVID outbreak. Can you provide an update on the current unit outbreaks at the health center?
Yes, unfortunately, early in January, RVH, along with our partners at Simcoe Muskoka District Health Unit, declared an isolated COVID-19 outbreak on our integrated stroke and rehabilitation unit. So to date, there have been 9 positive patients, as well as 17 healthcare workers associated with that unit. They've all tested positive for COVID-19. And tragically, 3 patients have passed away. And then just this week, we declared a second outbreak on our transitional care unit, where 1 healthcare worker and 1 patient tested positive, and sadly, 2, that patient died. So we have implemented our outbreak management protocols, which includes enhanced infection control practices, cleaning, surveillance, education, and frequent communication to patients. Both units, though, are closed to new admissions, and patients are safely quarantined in their rooms. These were the first COVID outbreaks at RVH since the pandemic was declared in early 2020, and it's sad. It is a sobering reminder of how rampant, infectious, and invisible this virus is, and how important it is to remain diligent in our use of all safety measures, including wearing a mask in public, avoiding gatherings, and always maintaining a 2-meter distance from others.
You have worked in healthcare a long time, Janice. Have you ever seen anything like this?
No, I've been a healthcare administrator for over 30 years and a CEO for 2/3 of that time, but I've never seen anything like this, and I hope it is a once in a lifetime. It has been a very long and a very uncertain year. I see exhaustion in the eyes of our staff and physicians. Despite that, they always respond into this healthcare crisis with resilience, strength, and always compassion. Thank you, team. I've never been more proud to work alongside them. Honestly, the energy they find every day, it's humbling, it's inspiring. But also, I want to mention the importance of the gratitude and the encouragement we've received from our community. And the community may never know just how much that has meant to us as we've faced each and every day. No one knows how long the pandemic will last, but please do your part to contain it would be my message tonight. And Be assured that when you need RVH, we'll be there for you and for the people that you love.
Thanks, Janice. You certainly raise an important point about our community and how it has rallied behind our frontline workers right from the very beginning. Mayor Lehman, these are tough times for municipal leaders. Residents are under a stay-at-home order. Most businesses are in lockdown. Schools are closed. How is our community responding to the pandemic?
Well, the sense I get is people are very, very tired, very fatigued, as Janice has said. It has been nearly 11 months. And especially, as Dr. Gardner said, through the last 5 months of second wave, it's been increasing levels of restrictions. There's some preliminary numbers now that suggest this may be working. Too early to tell, and certainly too early to tell when things might change back. But finally, we are starting to see a leveling off, and that is largely because things have changed in terms of the way people have responded. Cell phone data now shows that people are moving around less. We know that many workplaces are now closed that were open before. I heard this week a very apt description. The virus doesn't move. People with the virus move. And when we are moving less, and finally we are moving less, the virus may start moving less. And with the potential emergence of more contagious variants, that will continue to be so important. But the response from individual residents to get into groups, online, I should say, and start helping one another out has been just remarkable. There's a Facebook group that many will know, Barrie Families Unite now, with over 12,000 members that help people on an individual basis with referrals, calls, deliveries when that was possible. And there were so many efforts by people in the first wave and now again in the second wave to support our essential and frontline workers. I've often said in the few occasions when I've had to, which was usually 1 or 2 days of emergency, that the character of a community is found in its toughest times, in adversity. Well, we've had 11 months of adversity, sometimes more adverse than others, and right now probably being the toughest. And we're showing a very strong character in our community.
It has brought out the best in people, for sure. Now, you're chair of the Ontario Big City Mayors. Certainly, reaction to the lockdown across the province has been mixed. In your view from the mayor's chair, have the right restrictions and the right supports been implemented?
Well, it's a tough question to answer because if you were to ask the mayor of Kingston, for example, who have had perhaps the lowest incidence of COVID in a city in Ontario, the restrictions were very severe. If you were the mayor of Mississauga, Bonnie Crombie, or Patrick Brown in Brampton, you might well feel that the restrictions could have gone further or earlier. It is a very difficult thing to second guess, of course. Are the current restrictions necessary? Absolutely. And the reality is we live in a time when people commute back and forth between jobs, and we need to stop doing that as much as possible right now. I think we now, tragically, in our own community, Dr. Gardner referred earlier to how quickly the virus